Hello, this is David Lee, and welcome to today's web conference, the National Intimate Partner and Sexual Violence Survey, NISVS 2010 to 2012 State Report, Implications for Prevention. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the United States government, CDC, or CalCASA. I'm really pleased to have so many of you from all across the country joining us. This web conference is being co-hosted with some of our leading national partners, the National Sexual Violence Resource Center and the National Resource Center on Domestic Violence. So it's great to have all of you here. So I want to just get welcomes from our partners. I'll start with Jen Grove from the National Sexual Violence Resource Center. How are you doing, Jen?
Hi, good. Thanks, David.
Great to have you, and we work very closely with them. And I'm also really pleased today from the National Resource Center on Domestic Violence, we have Rosie Delgado. Rosie is actually splits her time as the policy advisor for the National Resource Center on Domestic Violence and is also the policy director for Casa de Esperanza National Latino Network. So how are you doing, Rosie?
Doing well. Thanks, David. I'm very pleased to be here today representing NRCDV. Thank you.
Great, and it's really important in doing this web conference. We've gotten this new important resource that the CDC has released. We brought in the leading national sexual violence and domestic violence national resource centers. At the end, they'll be talking about some of the resources that they have available, and will be available to do commenting throughout the web conference. So I'm really pleased to have all of you joining us today. So the National Intimate Partner and Sexual Violence Resource, Sexual Violence Survey State Report was just released a few weeks ago, and I want to know how many of you actually have reviewed that report. So in the lower left-hand corner is a box, and go ahead and click. This has been a report that's come out. All of you have seen it because you did sign up for this web conference. It's long. It's over 280 pages. Some of us have, like myself, have gone through it in great detail. Some people, like our guests here, actually put together that report. But I want to get just a sense of who's familiar in the audience. And we still have a lot of no answers, but I will share the results. And about 1/3 of our audience have reviewed this, and 2/3 have not yet reviewed the report. So that's great to know. I'm sure that the number is going to increase. There's also a fabulous, we'll be sharing information on an infographic that has some of the information and a key points that has been put out by the CDC. That's also a way, if you're not going to read all the pages, it is a very robust report that we have available. So the learning objectives of today is we want you to be able to describe the key findings of the National Intimate Partner and Sexual Violence Survey State Report. So you'd be able to do that. We want participants to be able to identify opportunities that you can use the data from this report. And then for you to describe the implications for prevention practice. We at Prevent Connect are really focusing on that in order to be able to prevent to really end sexual violence, domestic violence, and stalking, as is talking about in the report, we have to be able to do more than respond. We have to be able to prevent that, and we need to use this data for that prevention work. So I'm really excited that we have this group here being able to here to join us for this presentation. So with that, I want to introduce our team of from the Division of Violence Prevention, National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. That is a mouthful, but I'm really happy to have the NISVS, members of the NISVS team. And so we are joined by Sharon Smith. Hi, Sharon.
Hi, David.
Great to have you. Also, Kathleen Basile.
Hi, David.
Hi. We also have Melissa Merrick.
Hi there.
Hi, and Leah Gilbert. I think this is the first time you've been presenting on a Prevent Connect web conference.
Yes, it is. Hello, everyone.
Great. All the others have actually worked with us in the past on various topics over the years, and so it's great to see so many of you here joining us. So thank you much. So Sharon, I am going to pass the podium to you as you are going to move ahead, and we'll be asking some questions to the audience. So Sharon, you now should be able to advance the slides.
Okay, great. Thank you. Hi, everyone. We're excited that the report has been released, and we're going to share some of the findings with you today. So this slide is an overview of the topics that we will cover in this webinar. We're going to cover some highlights of the data from the report, but not everything. Okay, first, a little bit about NISVS. The National Intimate Partner Sexual Violence Survey was funded and launched by CDC's National Center for Injury Prevention and Control in 2010 with support from NIJ and Department of Defense in 2010. NISVS is an ongoing nationally representative random digit dial telephone survey that assesses experiences of sexual violence, stalking, and intimate partner violence among adult women and men in the U.S., and it provides both national and state-level data. The primary objectives of NISVS are to describe the prevalence and characteristics of sexual violence, stalking, and intimate partner violence, who is most likely to experience these forms of violence, the health conditions and impacts associated with these forms of violence, and finally, to provide national and state estimates. NISVS was designed with this particular goal in mind. Okay, and here is an overview of what's included in the report. As I said, we're going to touch upon all of these, but give you the highlights. Unfortunately, due to the sample size, we don't have many stable estimates at the state level for race ethnicity, but we do include national estimates. And in the appendix, we include national estimates for all forms of violence for 2012 only, if you're interested in data for a single year. Okay, first I'm going to go over the methods in the sample used for this report very briefly. Data were collected in all 50 states and the District of Columbia. Interviews were conducted from January 2010 to December 2012 with a total of just over 41,000 completed interviews over the 3 years. Of those interviews, 22,590 were from women and 18,584 were from men. NISVS uses a dual frame sampling strategy that includes both landline and cell phones, and about 43% of the interviews were conducted by landline phone and 56.7% were by cell phone. The response rate across the 3 years was roughly 33%, but the cooperation rate was over 80%. So this means that once an interviewer was able to speak to someone and establish their eligibility, that person most likely continued with the survey. And because we are using 3 years of data, the data are presented as average annual estimates. So these are estimates based on a weighted average of the 3 years of data combined. So stated another way, this is the average annual estimate across all 3 years. This applies to the estimated percent of victims as well as the total number of people who were victimized. Okay, just a few initial points about the state data. In the text of the chapters in the report, we describe the state data using ranges from low to high. So in doing this, we've indicated the number of states with reliable estimates and counted the District of Columbia as a state for a total of 51 states. So keep this in mind. If all states and DC have estimates, then this is a total of 51, not 50. And there are instances where the number of reliable states is 50, so this means that all but one state had reliable estimates. If all states had reliable estimates, then we say all states rather than saying 51. In cases where relatively few state estimates are available, it was usually the larger states that were reliable. In the report, though, we've included all reliable state estimates, even if there was only one state. Second, we recommend using caution if comparing states. It's important to keep in mind that the prevalence estimates are based on a sample. Estimates that are based on a sample always include some amount of error. So this uncertainty or error is estimated with a 95% confidence interval. The confidence interval provides a range of values that likely include the true prevalence estimate. The 95% confidence interval means that we can be 95% confident that the true prevalence is within the interval. Estimates that have overlapping confidence intervals, as shown by the confidence interval in the tables, they might not be meaningfully different from each other. So this means that additional statistical analyses are needed to test for differences. In addition, there are variations in states in terms of demographics, social, economic, and cultural characteristics, and these could account for the differences in prevalence. Finally, the state estimates are based on the respondents' current residence. The lifetime estimates might reflect victimization that occurred earlier in life when they were living elsewhere. However, the state estimates are meaningful because they give a sense of the burden of victimization in a given state.
Okay, great. So let's go ask a question of our audience, Sharon. We talk about the state level data, and this is what makes this different than what we've done before. So I'd like to ask people in the text chat to talk about how would you use state level data? What's the value that you would have of getting this information? It's been great to get the national data, but we're also getting some of the state level data. So I'd love to hear from our audience, and go ahead and write in the text chat. And in this, you'll see there's many charts that go because of all the states. We get a lot of information, and so Erin talks about to inform our sexual violence and IPV prevention plan. Cassie talks about grant applications, inform our prevention efforts and practice, our prevention practice. A lot of how it's going to inform their work, educational information to providers, help shape legislation, and as a state coalition, they use the training and disseminate for prevention, for media policy and grants, to inform future objectives. So, educating parishes about the extent of people suffering, and it's often helpful to just get more local information, understand the burden that we're seeing, and raising awareness about sexual assault, working with legislators, grants, teaching university-level courses, and so great to see. Oh, and what a great audience. I recognize many of your names who are joining us. So Sharon, we see a lot of people that are seeing a lot of value of how they're going to be able to use this data moving forward. So Sharon, why don't we go ahead and jump into the sexual violence.
Okay, yes, Kathleen is going to do that section. Hang on, we were having an issue with our phone over here. Okay, she's here.
Hi, everyone.
Hi, Kathleen. Can you just be a little bit louder, please?
Okay. Okay, I'm going to start with covering the sexual violence section. And this slide just gives a sense of what categories of sexual violence are included in the report. So one thing we wanted to point out is one of the major changes in this report is the inclusion of the category contact sexual violence, or contact SV, as you might see it in the report. So we introduced this type of sexual violence in the 2011 report, but we include it more widely in this state report. And we wanted to provide something close to an overall sexual violence estimate because we thought it would be useful to the states. So as the title suggests, this category combines multiple forms of SV that involve physical contact of some kind. So it would include rape, being made to penetrate, sexual coercion, and unwanted sexual contact. So be sure not to confuse this category, contact SV, with unwanted sexual contact. That's a little bit different. It represents non-penetrative acts like fondling, for example. Also keep in mind that contact SV combines, as I said, a lot of different acts into one estimate, so it could range in severity. So as you'll see in the next few slides, we have more reliable estimates for sexual violence at the state level for lifetime experiences than we do at 12-month, than we do for 12-month experiences due to the sample sizes. Okay, so now we'll talk about the findings, and we're starting with national and state estimates for women for their lifetime experiences. And you'll see there in parentheses, we list a number of states with reliable estimates. As Sharon mentioned, if it says all states, that would be 51, including Washington, D.C. So here you see for contact SV, 36.3%, or about 1 in 3 women have experienced contact SV in their lifetime. I won't read the states. You can see them there on each line. For rape, it's about 1 in 5 women, the lifetime estimate, that's 19%. Sexual coercion is about 1 in 8 women have experienced that in their lifetime, 13.2%. Unwanted sexual contact is more than a quarter of women in their lifetime. Nationally, that's 27.5%. And non-contact unwanted sexual experiences is about 1 in 3, 32% lifetime experiences for women. This is also women's estimates, but these are the 12-month prevalence estimates. Same categories that I just shared for lifetime. Here we see contact SV is about 4% in the last 12 months for women. The state ranges are listed there. 1.2% of women experienced rape in the last 12 months. About 2% of women experienced sexual coercion in the last 12 months. Unwanted sexual contact is also about 2%, 12-month estimate, and about 3% for non-contact experiences. I just want to point out here that, as I mentioned, we don't have that many, we have few state estimates, I should say. We only have them for contact SV, we have 6 states, and for non-contact unwanted experiences, we have 2 states. Okay, so the next 2 slides will be similar, but these are the male estimates. This is the lifetime experiences for men, both national and state ranges. And you see here for contact SV, it's about 1 in 6 men, or 17%, in the lifetime experience that at some point in life. Rape is about 1 or 2% nationally in the lifetime. That's about 1 in 67 men. Made to penetrate is about 1 in 17 men, and that's 5.9%. Sexual coercion similarly is 5.8%, or 1 in 17 men in lifetime. Unwanted sexual contact is about 1 in 9 men, or 11%, the national estimate. And non-contact experiences is about 13%. And as you'll see shortly, we have more reliable estimates at the state level for lifetime experiences than 12-month experiences, particularly for men. But we want to note that we have a greater number of estimates for men in this report than we've reported in the past, due to the increased sample size of combining the 3 years. So moving to the 12-month estimates for men, here we see, similar to women, we only have state estimates for contact SV and non-contact unwanted sexual experiences. We have 3 states for contact SV and 2 states for non-contact. But I'll go over the national estimates. This is in the last 12 months, about 4%, 3.7% of men experienced contact SV in the last 12 months. 0.2% experienced rape in the last 12 months. 1.5% of men experienced being made to penetrate in the last 12 months. 1.4% experienced sexual coercion in the last 12 months. 1.7% experienced unwanted sexual contact. And 2.6% experienced the non-contact sexual experiences in the last 12 months. This slide gives national prevalence of contact SV victimization by race, ethnicity for women and men. This is both lifetime and previous 12 months. We have provided data for other forms of SV in the report by race, ethnicity, so this is just an example of what's in the report. As you can see here, all racial and ethnic groups experience contact SV, but the burden of victimization is greatest among racial and ethnic minorities, especially multiracial persons and American Indian Alaska Native persons. This slide focuses on the type of perpetrators of rape of female victims. This is just one piece of the information we give in the report. It's just an example of some of the type of perpetrator. data we provide in the report. So for female victims of rape, perpetrators were usually and often someone they knew. Most perpetrators were current or former intimate partners, that's 47%, and acquaintances, which is about 45%. The other SV categories, as I said, are shown in the report, but they're not shown here. As you can see, most of the state estimates that we have for type of perpetrator among victims of rape are for intimate partners and acquaintances, the two most common perpetrators. Similar slide for male victims. This is male victims of being made to penetrate. And for male victims of being made to penetrate, perpetrators, again, were usually someone they knew. Most perpetrators were current or former intimate partners, about 50 or 51%, and acquaintances, 44%. As you can see, there's very little reliable state data for the type of perpetrator for male victims. There's only, we only have 2 states, and that's for intimate partner perpetrator. And finally, for the sexual violence information that we'll share today, this slide shows a few examples of the sex of the perpetrator for some of the different forms of sexual violence. So at the national level, as you can see, there's female victims on the left and male victims on the right. For female victims, the sex of the perpetrator was overwhelmingly male across all forms of sexual violence. You can see there rape, sexual coercion, and non-contact experiences all had over 90% were male-only perpetrator, sex of perpetrator. For male victims, it was more of a combination of female and male perpetrators. So you see there for rape, the perpetrators were usually male. For made to penetrate and sexual coercion, the perpetrators were usually female. And for non-contact unwanted sexual experiences, it's split. About almost half had only male perpetrators, and about a third, or over a third, had only female perpetrators. We present other sexual violence categories and state estimates for sex of perpetrator in the report.
Great. Well, thank you, Kathleen, for sharing that information. There's a lot of information there, and I know Jen Grove later on will be talking about some of what the National Resource Center has done. But I want to get if there are any questions about the sexual violence data. And so this is a chance for you. Go ahead and write in there. One of the people, Kathleen, when we asked how they were planning to use the data, they were actually interested in data for males in order to inform and increase prevention and response for that population. So this is great to see how the information around male victimization is really, is so much in the report. So there was a question about, is there data on the victimization of trans or gender non-conforming folk?
No, unfortunately, we don't have that in this report, and we don't capture, I believe we capture transgender. Okay, not for these years, not for all of these years. So we don't, for state report, we tried to focus on things that we thought would be stable across states, and so we didn't include sexual orientation or transgender. I believe we started capturing transgender in 2012, but it's not included in the state report.
I do want to highlight that there is a, while not transgender or gender nonconforming, there was a special report done of NISVS data looking at LGBT, lesbian, gay, and bisexual populations, and we'll post a link to that in the text chat. I'm sort of making, as Meghna and I are working on getting all these links. So that's another report that has been released that's very good. Okay, another question is is about the difference, the national data from the, so how is this different than in 2011 there was the 2011 report that was published in 2014. Kira's asking, I think, was that the IPV report that was done that was released in 2014, or that was the actual report? So can Kathleen or Sharon, can you answer just how this is different than the previous reports?
Hi, this is Sharon. We had two different reports come out in 2014. So we had an IPV special report, and then we also had a summary report that was published as an MMWR for 2011 data. So both of those were published in 2014. So this particular report is the combined years of 2010 to 2012 and includes a lot more state estimates. We included state estimates in our 2010 report, but not in our 2011 report. But in the 2010 report, we have very limited number of state data. We didn't have, the sample size that we do with this report. So the focus of this report was to provide state data.
Right, and the piece that I think is really, right, I think it's really important to realize that by taking the data from 3 different years of collection, you're able to then get reliable numbers to report for more states, and that's why that's where this is different. So it's state data, and it brings it from multiple years data collection moving forward. Did I get that correct?
Yes, and then we were also able to provide some more stable estimates, just combining those 3 years. So if you look at the average annual estimate, looking at the national data, we're able to provide some stable estimates that we weren't able to provide for a single year of data. That was the other advantage.
Okay. And someone was asking for the incidence of rapes by males and finding that in the reports. We will go look and see which tables that would be. So Julie, we will have to look that up to get the piece. Can you clarify the difference between contact sexual violence and unwanted touch? Example, fondling.
So this is Kathleen. Contact sexual violence is kind of a catch-all. It's the closest we have to an overall sexual violence estimate. It includes everything that involves some kind of physical contact. So it includes rape, made to penetrate, sexual coercion, and unwanted touch, which is the other question. So the unwanted sexual contact or unwanted touch is just non-penetrative unwanted contact, like fondling, touching of any, of a sexual nature. So it's the unwanted sexual contact is in the contact SV estimate, but the contact SV estimate is broader than that.
Okay, great. Thank you very much for that question. There was also a question about, do you have any combined numbers for rape and made to penetrate for men? Which actually I think, Kathleen, you just sort of answered that by the contact SV includes the categories of rape and made to penetrate, correct?
It does, but it also includes sexual coercion and unwanted sexual contact. So it's broader than just those two, but it does combine them.
Okay. So there's a lot of conversation about male victims, which is really great in this conversation, and that these people are reporting rape by women. And so the question was that there's an issue where men are still not willing to admit that it's rape. Can you describe how you asked the question? Because you did not ask if it was rape, you actually asked about the experience.
Right, we ask behaviorally specific questions, so we never ask, were you raped or were you made to penetrate or anything like that. We ask about oral, anal, and vaginal penetration. Vaginal, obviously, only for women. But so we take numerous items that measure different aspects or different ways that one can be raped, and then we combine them into a rape estimate.
One thing to add is that in our appendix, we have a listing of the questions that we used in 2010, 11, and 12.
Okay, great. So that's great, and that's one of I think the real strengths of the NISVS is to be asking the behaviorally specific questions. Then you'll get this beyond those of how people label it, because I think that was a really good issue that Kim was raising. Do we know the place of origin, or do we assume that all respondents are U.S. citizens or legal residents? This was a phone that Martha asked. So can you just clarify, because this is a phone survey about current residents, correct?
Yes, it's a nationally representative phone survey of U.S. residents, but we do ask where they were born, and if they were not born in the U.S., we ask when did they come to this country. those data are not analyzed for this report, but we do have that in NISVS. But it's important to know that we don't know where the victimization occurred.
So the victimization could have occurred in the state where they currently reside. It could have happened in a different state, or it could have come from their country of origin or some other location.
Correct.
Okay, great. Is there more current data available, or is this the only survey since then? So maybe maybe you can just talk about how, this was collecting data from 2010, 2011, and 2012. Has there been data collected since then that hasn't been analyzed yet?
Yeah, so this is the combined, as we said, 2010, 11, and 12, and this is the most current data that we have available in the report. We are collecting data on an ongoing basis, and we're in the field now, so there will be more reports, but this is the most current information and data that we have.
And yes, this web conference will be archived and a recording will be available. So with that, I want to move on to the next one. Thank you for great questions. And let's talk about stalking and who is going to be leading this section.
Hi, it's Erin. I'll be leading it. Okay, so this slide shows how we define stalking in NISVS. So briefly, the NISVS definition of stalking is the same as in our previous reports. So a person was considered a stalking victim if they experienced multiple stalking tactics or a single tactic multiple times, all by the same perpetrator, and they felt very fearful or believed that they or someone close to them would be harmed or killed due to the perpetrator's behavior. So our prevalence estimates are based on this definition. Okay, this slide shows lifetime and 12-month estimates of stalking for women and men. As you can see, the lifetime prevalence for women is 15.8%. That's nearly 1 in 6. And for men, it is 5.3%, which is about 1 in 19. State-level estimates for women are 9.6 to 24% across all but one state. For men, 2.6 to 6.5% across 15 states. 12-month estimates are about 4% for women and 2% for men. And in the 2010 report, within the text, we had also included a footnote describing the lifetime and 12-month prevalence using a less conservative definition. And that less conservative definition included any level of fear versus being very fearful. We've included a similar footnote in this report on the pages where the stalking prevalence is discussed in the text, and also in the appendix where we include the individual 2012 tables. So if you're interested in looking at those data, just wanted to let you know that we had included that in this report. Okay, this slide shows stalking victimization by race ethnicity. All racial ethnic groups experience stalking, but the burden was highest for multiracial and American Indian, Alaska Native women, and multiracial and non-Hispanic Black men. The state estimates are shown in the report. Now, on this slide, we show the stalking tactics experienced by female and male victims during their lifetime. The women are in purple and men are in the light blue bars. The commonly reported tactics among victims were receiving unwanted phone calls, voice messages, and text messages. This was about 76% for women, 72% for men. The perpetrator showing up or approaching them. This was about 59% for women, 47.5% for men. And being watched, followed, or spied on. This was 44% for women and 31.6% for men. Note the two tactics on the right end, property damage and threats of physical harm. Those are new data to this report. We have not included either of those tactics in previous reports. As you can see, nearly 70% of both female and male victims experience threats of physical harm by their stalkers. And here are a few examples of state estimates. So the state estimates for women are in the light blue and men are in, purple, sorry, and men are in light blue. So for watched, followed, spied on for females across 45 states, estimates range from about 27 to 62%. For unwanted messages, for females across 48 states, estimates range from 59 to 90%. For males in 5 states, estimates were 66.5 to 86%. And for threats of physical harm for females across 48 states, estimates range from 49 to 84%. And for males across 5 states, 67 to about 93%. And this slide shows the perpetrators of stalking. The women are in purple, men are in light blue. For both women and men, perpetrators are usually someone they knew, and mostly intimate partners and acquaintances. 61.5% of female victims and 42.8% of male victims had an intimate partner as a perpetrator. 26% of female victims and 37% of male victims had an acquaintance perpetrator of stalking. And this slide shows a few of the state estimates. Women are in purple, men are in light blue. Female victims who reported an intimate partner perpetrator across 48 states, estimates range from 43 to 77.6%. And also for female victims with acquaintance perpetrators, state estimates range from about 20 to 42%. For male victims, there was only one reliable state estimate. This was 54.6 for having an acquaintance perpetrator of stalking. Okay, for sex of the perpetrator, during their lifetime, female victims had mostly male perpetrators. 84.8% had only male perpetrators. Male victims had a mix of perpetrators, being nearly evenly split, having only male perpetrators, 43%, and having only female perpetrators, 45.7%. The state estimates for the perpetrator are available in the report.
Great. Well, thank you, Sharon. And we're already getting some stalking questions coming in. So go ahead and keep on if you have questions about the stalking data. The first question was, do you have data that shows the progression of stalking into homicide or battery?
Where is that question? Sorry,
it was Kim McCorder's question at 11:42.
No, we don't have those data, unfortunately. NISVS doesn't collect data on homicide, so we wouldn't be able to collect that.
Right. And, of course, it is hard when it is a phone survey to ask about someone's experiences on that to move forward. So, though we do know there is, have been other studies that have shown how stalking, all studies of homicides have shown how stalking has been a behavior before then. So that is what we have seen in some other pieces. And then there was a question about, is there a breakout about the location of where the stalking has taken place, such as the workplace or versus home or other places? Anything about that? Any data collected on that?
No, unfortunately we don't have that question. Just due to having so many questions already in our survey, we can't possibly ask everything, but that is a great question that we would love to collect.
Great. I know that Casey, who asked the question, actually does quite a bit of looking at workplace and working with unions in being able to do prevention work, so I appreciate that. What was measured in unwanted electronic communication? Is that email, social media, and what's the difference between that and unwanted messages?
This is Kathleen. I just looked that up, and it's unwanted emails, instant messages, or sent messages through websites like MySpace or Facebook.
Okay, and the difference between that and a unwanted electronic communication and an unwanted message?
So we also measure unwanted phone calls to you or left you messages, hang-ups, texts, or voice messages. So those are the two different items that we measure.
Great, that's helpful. Did you ask the respondents in general what happened, or did you ask if if they experience each of the tactics specifically.
Right. We asked about this tactics specifically. So the questions,
Okay.
if you look in the appendix and look at the questions, you'll see the ones that we asked about, but we're asking about specific tactics and whether or not they experienced those.
Okay. And it sounds like the unwanted messages is a separate category than the unwanted electronic communication, or was it a catch-all that included the electronic communication, unwanted electronic communication?
No, those are separate.
Those are separate. Okay, and there were just a quick methodological questions that came up. Were the survey phone calls conducted in English or other languages?
They were conducted in both English and Spanish.
Okay, and then what was the age range of the sample that you did? Obviously 18 would be the youngest that you collected.
18 and older. We don't know the exact range.
Okay, great. Well, thank you. Those are great questions that are coming in, and so I appreciate it when people make it hard for me to keep up. But on that note, though, we are going to move to the intimate partner violence section, and I know there'll be a lot of questions about this one. And so let's go ahead. Who's taking the lead on this?
Hey, this is Leah Gilbert. How are you guys?
Hi, Leah.
Hey. Okay, so this slide shows the subtypes of intimate partner violence that are captured in NISVS, as well as their definitions, including sexual violence, stalking, physical violence, and psychological aggression. For a number of the estimates, you'll see that we include contact sexual violence. This is what Kathleen was mentioning before, that combined measure of rape being made to penetrate someone else, sexual coercion, and unwanted sexual touching or contact. We introduced this combined measure in the 2011 report. The other subtypes are consistent with what's previously been presented in NISVS reports. So this table shows the lifetime and 12-month prevalence estimates for women for the various forms of intimate partner violence, starting with the combined measure of contact sexual violence, physical violence, and/or stalking. On this slide and others, you'll see that the numbers in parentheses are the number of states that had stable estimates. We also include individual estimates for contact sexual violence, physical violence, and stalking. And at the bottom, you'll see there's a combined measure of contact SC, physical violence, and stalking, but with IPV-related impact. As you can see, about 1 in 4 women, or 27.4%, experience contact sexual violence, physical violence, and/or stalking by an intimate partner, and also reported at least one impact related to the IPV, such as fear, concern for safety, and injury. In a few minutes, I'm going to explain a lot more detail about IPV-related impact. This is a similar table, but for men, and includes both the lifetime and the 12-month estimates for the different types of IPV. As you can see, 11%, or about 1 in 9 men, experience contact sexual violence, physical violence, and/or stalking, and reported at least one IPV-related impact. You can see the number of states with reliable estimates in the parentheses. This chart shows subcategories of physical violence by an intimate partner. Women are in purple and men are in light blue. To the left is being slapped, pushed, or shoved, and on the right is severe physical violence, which includes being hurt by pulling hair, hit with a fist or something hard, being kicked, slammed to get something, choked or suffocated, beaten, burned on purpose, and/or the respondent having had a knife or gun used against them. Looking at severe physical violence, you'll see that about 23% of women and 14% of men have experienced severe physical violence by an intimate partner at some point in their lifetime. It's only in the prevalence of slapping, pushing, or shoving on the left that we find fairly similar prevalence estimates for women and men, with just under 3 in 10 women and just over 1 in 4 men reporting these forms of physical violence. In the report, we only provide national estimates for the subtypes of physical violence. We don't have the state-level estimates for this. Psychological aggression includes expressive aggression, such as name-calling, and coercive control, which includes behaviors intended to monitor and control or threaten an intimate partner. Nearly 50% of women and men have experienced some form of psychological aggression by an intimate partner in their lifetime. 12-month estimates were 14% for women and 18% for men. Within the subtypes, nearly 40% of women experienced expressive aggression and coercive control in their lifetime. And for men, 31% experienced expressive aggression and 41% coercive control. Most states did have reliable lifetime and 12-month estimates for both women and men, as shown in the parentheses. All racial and ethnic groups do experience IPV, but the burden was highest among multiracial, American Indian Alaskan Native, and non-Hispanic Black persons. This was true for both women and men, and state-level estimates are available in the report. You'll remember on the earlier slides I mentioned IPV-related impact. Here I want to explain a little bit more about that. So given that IPV can range from a single act of violence experienced one time to multiple acts of violence experienced over many years, it's important to measure the impact of violence. In NISVS, impacts are captured as negative experiences associated with a specific IPV perpetrator. Some examples include injury, needing services, and having PTSD symptoms. Impact is helpful in understanding the severity of violence, and by understanding which impacts are most commonly reported, we can focus our prevention efforts. To best understand the NISVS IPV-related impact measure, we need you to be aware of three things. So first, the impact questions are specific to individual perpetrators, but without regard for the time period in which the impact occurred. So for a 12-month measure, these are people who were victimized in the past 12 months by that perpetrator, but the impact could have been at some other point in the relationship. Second, the impact questions were asked in relation to all forms of violence committed by that perpetrator in the relationship, because violent acts are often experienced in the context of other violence. For example, if the respondent experienced both psychological aggression and rape by the same intimate partner, this combination may affect the impact. Third, when we say IPV-related impact, we are specifically referring to contact sexual violence, physical violence, and or stalking by an intimate partner, where the respondent had at least one impact at some point in their life from this or other forms of IPV in that relationship. So as you'll see in this slide, in the U.S., 27.4% of women and 11% of men experienced contact sexual violence, physical violence, and or stalking in their lifetime by an intimate partner with related impact. 4.7% of women and 2.2% of men nationally experienced contact SV, physical violence, and or stalking by an intimate partner in the last 12 months, and experienced IPV-related impact by that perpetrator at some point in their life.
Leah, can I just want to stop for 1 second? I think this is a really important point that you made, and I want to ask Rosie, I think that looking at IPV-related impact is really important. Can you just talk about from your perspective of why this is really important for us in the work that we're doing?
Yes, thank you, David. And, we really want to appreciate the effort the CDC made in this research to really lift up the impact of the violence, and that is really important, as we all see in our work. And I think, just to put it in context, for example, if someone reports that they were pushed or shoved by an intimate partner, while that's not a positive thing in any relationship, the impact is what's important as well in our work, because if they just shrug it off, it's very different than if the impact is that it actually made them afraid, or if it caused them to fall down the stairs and have a physical injury. And so I think that's what's really valuable about this NISVS study. Sometimes some of the regular conflict tactic scales sort of have equated all pushes or shoves to be the same regardless of the impact that it has on someone. And so that's why, DV advocates in our work for the past 30 years have really tried to focus on what the negative impact is and how we can use that in our prevention and our intervention efforts to help people.
Great. Well, thank you very much, Rosie. I think it's helpful. This next chart that Leah's going to share, I think really goes through what some of these impacts are for women and men and shows some of those differences. So, Leah, why don't you go ahead? This is a really interesting chart.
Right. So this slide shows the distribution of specific types of IPV-related impacts amongst victims. So women are in the purple bars and men are in light blue. Among victims of contact SV, physical violence, and or stalking by an intimate partner, 73% of women and about 36% of men reported some type of IPV-related impact. As you can see, being fearful and concerned for safety are the most commonly reported impacts, and for some other specific examples, about 52% of women and 17% of men reporting having PTSD symptoms, 35% of women, 12% of men reported being injured, and about 19% of women and 5% of men reported needing medical care. In this report, but not shown on this slide, we also include estimates for having become pregnant for female respondents and having contracted an STD for respondents who had been raped or made to penetrate. So the previous slide showed national estimates. Here's a few examples of state estimates for IPV-related impacts. The first row shows any reported impacts, and then there are a few examples of state ranges for other types of impacts. More data is available in the report, and more estimates are available for female victims than male due to a larger sample size.
Okay, so thank you, Leah. Questions have already started coming in, so go ahead and let us know what questions you have about the intimate partner violence data. So I'm going to start doing this, going through the questions. Can you talk about financial coercion or abuse captured in the survey? And if not, why?
No, we don't capture financial abuse. It's just an issue of not being able to include all of the forms of IPV survey.
This is Kathleen. We do, however, as part of the coercive control items, we do have a measure about controlling. Do you have it there? We're looking for the measure. Kept you from having money for your own use. So it gets at financial abuse. We don't have an extensive set of questions on that, but we do have that as part of the coercive control items, which is part of the psych aggression that we presented earlier.
Great, thank you very much. Is there a combined DV rate that includes psychological aggression? Because you do separate out the psychological aggression from the other forms of violence. And so can you maybe, because you don't actually have a combined one, you want to explain why you do not?
We don't have a combined with psych aggression. Honestly, I don't remember our exact thinking. We for this state report, we did it similar to how we did it in 2010, and my guess was that it would combine, some of the psych aggression has very high prevalence, so combining what we do combine, which is the contact SV, physical violence, and stalking, is a little more of a conservative estimate, but we tried to focus on what we thought would be the more severe forms. One could argue that we should include psych aggression in there because it's part of our definition, but for these analyses, for the reports that we've done so far, we have not combined psych aggression in the overall IPV that we report. We do have plans to do more, look more at the psych aggression measures in journal articles and other papers, and at some point we could combine it. We just haven't done it to this point.
If there was another psych aggression question, looking at the summary of the results, it said nearly 1 in 2 men and women experience psychological aggression by an intimate partner. Is that fair to say? And maybe we should go back to that slide so we can be able to see that that's the state data. That's the data there. You had both for women, it was 47.1% national sample and 47.3% for men that experienced any form of psychological aggression.
That's correct.
Okay, so just want to be able to get that. Is there any way to break out specific tactics in extreme physical violence, such as choking and strangling? Were those separated out?
Not for this report. They weren't separated out, but they are included in the measure.
Yeah, the questions are asked individually, so you could theoretically separate that specific behaviors out.
Thank you very much. Was an interesting question, did we see an increase from the previous report? Of course, remember this is data that is 3 years data. This was not done comparing year to year to year, but there was a question about seeing differences, any differences from reports. So anything you want to say about that?
So just so I'm clear, the question is, have we seen increases with these data compared to previous reports? Is that the question?
Yes. Yes, it was.
The answer is no, and it's probably largely because this data is a combination of the 3 years, so it includes 2 of the years we've already reported on. The only new data here is 2012. But if you look in the end of the report at the 2012 data, I believe there are no large or substantial increases, but one can look at that data and compare it. But from our perspective, there haven't been many increases.
And we haven't done statistical tests to see if those differences might be significant or not between 2010 and 2012.
Right. But this is something that over time is something that by continuing to collect the NISVS data, we can then identify trends, but it would take a period of time to do that.
Absolutely.
Okay, there was a question about traditional gender roles require that men act tough or just get over it. Do you think this might have caused a lower number of IPV-related impact in men? I.e., for example, the incidents were still occurring but shrugged off due to pressure to conform to traditional gender roles?
Sure, that's one possible hypothesis. We can't determine if that's accurate or not, but it's a reasonable explanation.
Okay, so that's there. What's the percentage experiencing post-traumatic stress disorder post-IPV trauma? You did measure as one of the impacts people experiencing post-traumatic stress symptoms, correct?
Yeah, we measure if the respondent has experienced symptoms of PTSD.
Right, not whether there was a diagnosis or not.
Correct.
And that percentage, I'm just trying to see if that was measured. You saw on this chart here that we put up, you can see anyone that indicated any post-traumatic stress disorder symptoms. It was for women 51.8% and 16.7% of men was on this chart here.
And that's just a note, that's among victims.
Among victims. Thank you for clarifying that.
Sure.
Okay. I love how I am trying to go through and read all of these. These are great questions. Is there a possibility of having a more, I love this. You've already got a request for a more in-depth presentation at an upcoming conference from Deb DeBear, who is suggesting a future meeting. So I think you would contact CDC and explore with them about the opportunity to do that. And we have the contact information at the end of the web conference. So I'm not going to put them on the spot to have to confirm yes or no for that. Then did the information service regarding IPV victims who had not suffered abuse or assault prior to entering the abusive relationship? I'm not sure I'm understanding that question. So Herb, if you can clarify that, I'm not sure I'm understanding that, so I'm going to move on to the next one. Do you think the male reports of impact are due to the idea of masculinity? You already addressed that issue. And then any information on how many of these resulted in police reports or arrests?
No, we don't collect those data.
We only collect the need for services, so that's the closest we would get to that, but not actual police reports.
Okay, great, thank you. And were there any surveys about family income to be able to look at income?
We do collect income, I believe.
We collect household income.
Household income.
Household income, though that was not included in this analysis, but that has been collected.
It's current family income, so it may or may not be the same income when the victimization happened.
So that's a good point, and that's, as many of these, is what the current income is, not when the victimization took place. Oh, no, this is a great question, Beth. Which ways can we use this data to create change in knowledge, attitudes, beliefs, and behaviors at a community level to convince that this is a problem? And so I'm actually going to come back to that later, Beth, to think about how we're going to be using this for our prevention work. So I think it's a really great. When needing medical care, this is for physical injuries, does that include mental health care?
So the question is, did you ever need medical care because of any of these things that happened? So it could be for physical or mental health issues.
Okay. Any thoughts about why the population, the Asian, had the lowest rates of IPV, stalking, and sexual violence? And you've seen this in other reports. I think, Rosie, you've also written about, have looked at some of the different ethnic ones too, so you might want to have a comment. So anything CDC wants to say about the reports that showed lower rates for people who identified as Asian?
I mean, we haven't looked at that specifically, but one hypothesis would be low disclosure in that community. There may be other hypotheses.
We're interested in Rosie's thoughts as well on this issue.
Yeah, thank you.
Rosie,
no,
I'm putting you on the spot, Rosie.
It's a really good question, and thanks for asking. And there is an API GBV resource center that's a FIPSA-funded resource center that has a lot more research and data on their website, and they have seen different results, based in different communities. As we know, the API community is very diverse. So I know sometimes it's also helpful not to look at it in the aggregate, but look at different communities, as well as the challenges and barriers on language access, on acculturation. As was indicated, the survey was conducted in English and Spanish, but not other languages that might be relevant to the API community as well. And I do agree that low disclosure may be part of it. Even when you think about it, to be perhaps an immigrant from another country and you suddenly get a phone call from someone identifying themselves with the government asking these kinds of questions, I would imagine, this is sort of speculation, but it would be good to do some additional, qualitative research on what is the likelihood that those individuals, A, would want to complete the survey, and secondly, engage in full disclosure. I think certainly in this anti-immigrant climate we find ourselves in, there's a lot of fear as well as what the repercussions could be.
Thank you. I think those are really important points that you're raising there for us to think about. Herb, you asked a question about the distinction between education programs for children and prevention versus training around healthy relationships. Subtle but different focus. Let's come to that at the end when we talk about prevention. Great question. Is the raw data available for researchers to use outside of the CDC?
The 2010 is available for public use. 2011 will be available sometime in the near future. We're working on that. Okay, and they would contact the NISVS team to be able to know how to be able to access that data.
Right.
Okay, and then there's another. Oh, I'm sorry. Was there another comment? Great. And then Meghna did post the API GBV resources website in the chat, and Amy also gave her perspective that low numbers might be related. Talks about underreporting and that collective identities rather than individualistic than other cultures. So might have some way of impacts victimization of crime, especially when it's within the family. So thank you all. That was really great. Let's now move to the next section. This is great questions, and we want to make sure we take the time for it, but this is to me, one of the most important findings is looking at how violence was experienced as a minor. So I believe, great. Melissa, this goes to you.
Yeah, perfect. Thanks, David. And so next, if you're following along on your really hefty reports, we include a chapter on violence experienced as a minor. Of course, you recall that the NISVS sample is made up of adults, but we do ask the age when the violence first happened. So even though it's a retrospective survey, we can determine the prevalence of violence that was experienced as a child or adolescent. We know from NISVS and other data sources that violence often begins early in life which is critically important because we know that victimization in childhood puts youth at risk for subsequent victimization in adulthood. So in terms of thinking about our prevention strategies and approaches, looking at violence early in life is critically important. So here we see that in the United States, 7% of women, or 1 in 14, experienced completed rape before turning 18. And here we only looked at those who experienced completed rape. Also, about 3% of women experienced stalking before the age of 18. 7% of women in the U.S. experienced completed rape, physical violence, and or stalking by an intimate partner, and experienced these or other forms of IPV by that same partner before their 18th birthday. An important caveat here, and for when you're looking at the report, a small subset of female victims of completed rape could have also experienced attempted made to penetrate or attempted rape by the same perpetrator. So the age at first could be reflecting some of those experiences. So here you can see a figure that shows the age distribution among female victims of completed rape. So here you see that 41.3%, or 4 in 10, female victims of completed rape reported that it occurred before age 18, with 30%, or 3 in 10, reporting that it occurred between the ages of 11 and 17, and 11.2% at age 10 or younger. As a reminder, completed rape excludes attempts. The caveat, of course, I gave on the previous slide applies here as well. And here it's important to note that the reported age is the youngest age reported across all perpetrators. So victims with unknown age are not represented in this figure because the estimate was not statistically reliable. For men, 1.3% experienced completed made-to-penetrate victimization, and a little less than 1% were stalked before the age of 18. 3.7% of men experienced completed made-to-penetrate, physical violence, and or stalking by an intimate partner, and experienced these or other forms of intimate partner violence by that partner before turning 18. Similar caveat here for men. A small subset of male victims of completed made-to-penetrate could have also experienced attempted made-to-penetrate or completed or attempted rape by the same perpetrator, and the age at first could reflect these experiences. And here in this figure, among male victims of completed made-to-penetrate victimization, 24.3%, or about 1 in 4, reported that it occurred before age 18, with 19.6% of male victims reporting that it occurred between 11 and 17 years of age, and 4.7% at age 10 or younger. Again, the reported age is the youngest age reported across all perpetrators, so victims with unknown age are not represented in this figure.
Great, let's move to health impacts.
So we also examined associations of health conditions that were examined in NISVS with the experience of contact SV or stalking by any perpetrator or physical violence by an intimate partner. At the national level, those who experienced those forms of violence were significantly more likely to report 8 of the 10 health conditions that were measured in NISVS, and here you can see the 8. Compared to those with no history of these forms of violence. And this was true for both men and women. Here you can see again the 8 health conditions are shown on this slide. There were not significant health differences for diabetes or high blood pressure. And in the report, we do present these comparisons at the state level when we can.
Okay, this is Sharon. So just a few cautionary notes. First, some of the estimates were not reliable even with 3 years of data, so that means that we'll need an even larger sample to provide estimates that were not reliable in this report. Second, it's becoming more and more challenging to gather survey data by phone, and this can affect the representativeness of the sample. So recall that the response rate across the 3 years was roughly 33%, the cooperation rate was over 80%. Next, there are always issues with respect to recall and self-report surveys, such as telescoping, which is the tendency to perceive events in the past as having occurred sooner than they did in reality. So this is an issue that can affect 12-month estimates in particular. We addressed this issue by anchoring respondents to the date that was 12 months earlier. Next, the estimates provided are likely underestimates of the true prevalence. There are a number of reasons for this. First, although NISVS captures a wide range of violence, it isn't feasible to capture all forms of SV, IPV, and stalking. So participants might have experienced violence that wasn't included in our survey. Second, telephone surveys may not include certain populations, such as those living in institutions, prisons, nursing homes, and homeless shelters. And finally, there are potentially issues related to disclosure. For example, victims may only disclose to those they feel closest to or not disclose at all. Some respondents might not feel comfortable talking to an interviewer about their experiences, and some respondents might not feel comfortable disclosing if the perpetrator lives in a home or is nearby. And here are some ways. Sorry. Go ahead, David.
Go ahead. I'm aware that we want to go, Sharon, a little quickly because we have such great questions. We do want to be able to get to these resources, but we want to, so hurry up a little bit.
Okay, so here are some ways that NISVS data can be used. Given the potential for ongoing health and service needs, these estimates can help states better understand the burden of violence in their populations. Second, data are helpful in understanding the magnitude of these kinds of violence and the potential impacts and needs of survivors. Our state estimates reflect the current residence of respondents, so NISVS data can provide important information about the proportion of women and men with victimization histories that are currently living in a particular state. Data can be used to examine patterns in SV, stalking, and IPV, and to evaluate and track the effectiveness of prevention efforts. And data can be used to identify specific populations for targeting evidence-based prevention approaches that are included in our child abuse and neglect and Stop SV technical packages. And we have an IPV technical package coming soon. The other two are on our website. Technical packages compile the best available evidence for prevention of child abuse and neglect and sexual violence. And these can be used by states and others in the field to guide prevention planning. This is a snapshot of what's included in the child abuse and neglect technical package. We know that starting prevention efforts during childhood can prevent multiple forms of violence from occurring later in life, in both adolescence and adulthood. The strategies with the most evidence of effectiveness for preventing child abuse and neglect are a combination of strengthening economic supports for families and changing social norms to be supportive of parents and positive parenting, providing quality care and education, enhancing parenting skills, and then intervening to lessen harms if child abuse and neglect does occur. And it's important to note that violence prevention must continue throughout the lifespan. Okay, and then here's a snapshot of the strategies and approaches included in the SV technical packages. So these emphasize a focus on youth and also span different developmental stages, including adolescence and adulthood, and different levels of the social ecology to focus not only on individual level skills, but also relationship and community level approaches to preventing SV and IPV. Finally, a comprehensive prevention approach as outlined in these technical packages should involve numerous sectors beyond public health working together. And here's where you can access the report and the fact sheet and the infographic.
And the infographic is very long, so you're going to see lots of pieces, but it's all on the website. But I want to just jump to our co-host, Jen Grove. Can you just talk a little bit about what National Sexual Violence Resource Center has available to help support people around this data?
Yes, absolutely. I'm fascinated by all the great questions everyone's asking. So the National Sexual Violence Resource Center developed some talking points and a blog post to go along with that. The talking points in that we include key sexual violence statistics that we pulled out of the report, and then we also offer some thoughts about how this data can inform our prevention efforts. And so we hope that folks will go to the website, to that link, and check out the resources or the information that we have there and the links that we have there.
Thank you. Rosie, can you talk about the National Resource Center on Domestic Violence?
Yes, thank you. So the National Resource Center on Domestic Violence has VONIT, and you'll see the site there, vonit.org, where you can get more materials about this survey, but also thousands of materials across a whole range of issues on intimate partner violence. Also, if you go to the main homepage, nrcdv.org, you will see that there's also links to other web pages such as preventipv.org that has all kinds of resources about prevention, as well as the DV Awareness Project that has lots of resources that people can use to raise awareness in their communities.
Great. And Rosie, I just want to also add that I know the National Resource Center on Domestic Violence send materials to each of the state coalitions around some of the issues about talking points and their ways, strategies to be able to do with it. Those are not posted on their website, but to contact directly if you want to, if there's some issues that you want to be able to talk about how to address with the IPV data. So
yes, absolutely. Thank you, David.
Great. So we are getting to near the end, and we don't have as much time for discussion around prevention because we're running out of time, but I think the prevention implications are very important. And in the report, these are the different headers. It's important that in doing prevention work that we do cross-cutting and multi-sector approach, that it's not one sector on their own, but to look across many different sectors to be able to make that contribution. And I often see public health that does a great job of convening, but there's many people that do convening, and we want to include those different groups in moving forward. The data here around youth is very powerful to me, that early prevention efforts are essential and that they need to continue across all developmental stages, and that early prevention efforts is something that's an opportunity, and I think is something that aligns what we're doing. We often want to look at ways that we look at not just prevention efforts that might be cross different forms of violence. Earlier, Sharon had said that the child abuse prevention is very important because that can have an impact in preventing other forms of violence, perpetration or victimization down the road. The prevention approaches are many that we can use. There was someone raised the question of the difference between doing education around gender socialization versus doing stuff around doing work around healthy relationships. There's a range of those. The CDC has done an excellent job in their technical packages to highlight them. The IPV technical package will be released soon, and Prevent Connect and the National Resource Center on Domestic Violence will be working with CDC to host a web conference on that release to share those pieces. And finally, prevention can be used to help create data systems for monitoring and evaluating what we're doing. So, Regina says, is this an opportunity in the data to make an argument to our funders to fund prevention efforts? And I absolutely believe that this is a report that talks about that there's such a high burden within all of our states of such violence, and that the investments of prevention are wise investments to be able to prevent the cost that does this. But let's talk about here, how do you, and let's ask the audience as we close out in our final minutes, how do you plan to use NISVS data to support your prevention efforts? What are you trying to be able to do? And Regina, you asked the question. That was great of how we're going to be able to do that. And Jen is pointing out that NSVRC does have some of those pieces that are available. I apologize we are not able to, so I'd love to hear you just talk about how you plan to use this in your work. Rita talks about engaging men and considering new sectors to coordinate with. Is another comment that came in that I think is a really important piece, and that I find using this report has been very helpful in being able to give us a sense of what's taking place and think about the possibilities of how we can be able to create change. So as you are going ahead, if you want to get information and questions about NISVS, including requests for other presentations, you can contact NISVS at nisvsinfo@cdc.gov, and that's how you can be able to contact them. And so that's a really great place to do this. Great to see people keep on doing the comments. And so with that, I really want to thank all of our speakers today. We had Rosie Algado representing the National Resource Center on Domestic Violence, and she's also the Policy Director at Casa de Esperanza, the National Latino Network. We had Jennifer Grove from the National Sexual Violence Resource Center, and our team from CDC now you're testing me on remembering all of our, Leah Gilbert, Melissa Merrick, Kathleen Basile, and Sharon Smith. How is that for getting everyone there? I want to thank all of you. There's a few last comments that are coming in. This was a really great opportunity to share with each other. We will continue this discussion about how we will do our prevention work. We invite you to join us for future Prevent Connect web conferences as we explore the technology of prevention and how we can work and learn from each other. So I want to thank all of you for participating today. This will conclude today's Prevent Connect web conference. I'll keep the text chat open for a few more minutes. Thank you all for joining us, and we look forward to seeing you at a future Prevent Connect web conference.